Welcome everyone to Fibromyalgia Talks. I am your host, Nisi Edwards. This month, the month of May, as of May 12th, is Fibromyalgia Awareness Month, but we celebrate it the entire month. And so today I have with me a speaker. His name is Dr. Timothy Demchak, PhD, ATC. And welcome, Dr. Demchak. Welcome to Fibromyalgia Talks.
Thank you, Nisi. Thank you for inviting me to be part of this. This is an exciting to always talk about fibromyalgia and try to help people out.
Thank you. This is something that I live and breathe every day with fibromyalgia. And can you give my audience more information about yourself? Introduce yourself if you wouldn't mind, please.
Certainly. I'm a professor at Indiana State University. It's in Terre Haute, Indiana. I teach primarily undergraduate students who are pre-physical therapy, pre-occupational therapy, massage therapy, pre-athletic training, pre-physician assistant. And then I also teach in our athletic training program. But I also ran a free clinic for an underserved population in Terre Haute for 9 years. So I treated a lot of people using laser therapy, combined with exercise and those type of things. And then currently I do some research with Multi-Radiance Medical and a group on Norway and Brazil who just finished doing studies with fibromyalgia.
Great. Now, if you don't mind me asking, what was your journey to fibromyalgia? And the reason why I asked that is, how did you get involved with this field? Is because many people still don't know what fibro is. I've even had some doctors, may be surprising, maybe or maybe not, that when it comes down to fibromyalgia, they have not seen very many fibromyalgia patients. So it's kind of like hunting, here and there, trying to find somebody who knows what it is and that you get diagnosed in time. So when I received and learned about who you are and the FibroLux, I was very, very intrigued. So what was your journey into this foray of fibro?
So my journey was, like I said, I mentioned I started a free clinic in our city to help people underserved population to get back into the clinic. I've been on campus teaching and doing things for the university, but I wanted to get back to clinical practice because I missed it. So I started it to not only treat people that needed it, but also to bring students in to see a different population than that 18 to 24-year-old healthy athlete, right?
Okay.
As an athletic trainer, I really wasn't trained to treat people with fibromyalgia. It's not something we talk about, like musculoskeletal injuries and fibromyalgia kind of didn't coincide. But anybody who walked in the door, I treated. So I had a fibromyalgia patient who was 19 years old. I had just started using laser in the clinic. I had known about laser and taught it in classes, but I was using it. And she had chronic pain. I knew laser helped with pain. I'm like, you want to try this and see if it works? She's like, sure. And it worked. And she went from a 19-year-old college student who could barely function at school to graduating on time and being going on to law school.
That is awesome. Now, for light therapy, well, this is laser therapy, right?
Laser and light therapy kind of combined.
Okay. I've heard a lot about laser light therapy. There are some people who, I forgot what they call their own handheld devices, but I've gone to some health fairs where they've had some of these devices, but not the FibroLux. They had their own handheld. And one of the questions that a member of my support group asked me is this something that the consumer can do? And I mentioned to her that this was an FDA approved product. And to my understanding, this had to be administered by a healthcare professional.
So yes and no.
Okay.
So to take you through the journey a little bit more and talk about how FibroLux got developed is I wrote up a case study about that first patient I saw with fibromyalgia, and that got published. And then I saw some other cases, and one of those actually we had a different laser, but from the same company that I was leaving to go to a conference, and I loaned it to the patient to treat with her. She treated herself at home.
Okay.
And went from 14 tender points to 0 tender points in 4 days. Went from an average pain of 8 out of 10 to 0 in 4 days, treating herself at home.
Okay.
Okay, so it's the same company, but a little different product for them.
Okay.
The FibroLux got developed over time to get FDA cleared because, with FDA, in order to sell it and market it, you have to be able to prove that it works.
Okay,
So the FibroLux is a laser that's FDA approved. It is straight light therapy, so technically anybody can use it. So they could sell a product to you to use that and teach you how to use it at home.
that is
Okay.
awesome. Now, I am in the Midwest in Illinois, and I know you're in Indiana, but
Mhm.
for people who are interested in this type of therapy, well, before I even go there, it's handheld, correct?
It's handheld, battery
Okay,
powered,
no pain, correct?
no pain. You don't feel technically anything when you're
Okay, hey,
treating.
that's even better because fibro patients, we have had enough pain in our life.
Yes, you have.
Okay, so how would a patient get started with FibroLux?
So I think the first thing you would want to do is see if there's any therapists in your area, like physical therapists or chiropractors near there using light therapy already,
Okay,
right? Is there a way for you to see if it's actually going to work for you? Okay.
okay. And is this
And
something covered by insurance?
it really depends on your insurance and depending on
Okay,
how they're billing it out, right? So
right,
like most chiropractors are cash only. So it might
true,
be where they're billing it as, hey, here's how much it would cost for you to get treated for X number of minutes, or however they're billing out, whatever, how their billing scheme.
true.
Um, and then other places, there are some physical therapy clinics who bill you by, we're going to charge you X number of dollars per session, regardless of what you do. And then there's others that are billing piecemeal, right? Here's a 15-minute,
Right,
here's exercise for X number of minutes. Here's, laser therapy for X number of minutes. Here's, this. So it depends on how you're billing out, right?
true.
Um, and in the ideal world, they would bill you like either by the minute or by a session or something like that. But everybody bills a little bit differently.
Okay.
So that's the first
Another
thing.
way, I'm sorry, go right ahead.
Is figure out how they're doing it. Ideally, you want to see if it's going to work for you or not, right? We
True.
know there's responders and we know there's non-responders. The research studies that have been published, everybody has responded. So there are 2 published case studies with this same technology and one full-on randomized control study that added exercise to it, and then the one that was done with FibroLux, which is in the process of being reviewed before it gets published. So that's out for
Okay.
review right now. Mhm.
I was thinking that this may be something that could be so with insurance, you know how every year or whatever, when you sign up for flex spending or whatever, you can
Mhm.
put some dollars into that. What occurred to me is this may be something that someone could put X amount of dollars. Now, how much does this device cost?
So that's something that's determined by the Multi-Radiance Medical. I don't know how much they're charging for
Okay.
that. I don't sell for them. I help with research. I write papers. I do webinars with them. Um, but I don't sell. What I do know is there's another product that they have that's called a Pain Away that has been approved by certain workman's comps for fibromyalgia. So I know they've had some success that way. Um, so I think there's some things out there that are, and that's usually it's a lower power device that would still probably work with fibromyalgia. So I know they've had success with that. And the price point might be a little bit better for a home use. I'm going to own this product versus the
Okay.
FibroLux might be priced more for like a clinical setting. So like a physical therapist using it or rheumatologist or
Makes
chiropractor in
sense.
their office.
Yes.
So it's a little bit different device wise, how many different settings you can use and what it could be used for. But I know they've had some success with workman's comp and getting it paid for that way with certain patients. So
Okay.
again, there's some alternative ways to do it, but a flexible spending account would work. I think it's looking at how much money are you spending out of pocket beyond insurance for all of your treatments,
Hmm.
and how much would this work? And again, before you would buy that product, I would want you to at least try with one of their multi-radiance medical lasers to see if it's going to be effective treating your fibromyalgia,
And
right?
did you say that another one of the related products is Pain Away, as
It's called a
in
Pain Away. Mm,
AWAY with pain
Yep.
away? Oh, okay.
That's
I
what
will look that up.
so the one case series I did, it had, she used the pain away when she treated herself 4 days in a row. That was a pain
Okay,
away that we allowed her to take home and use. And it was the original pain away. So now it's like a 2.0 version. So hers was actually the original one. And it worked well for her. And again, making sure it's going to work for you before you buy any product is going to be really important.
true. Now, where, since I know it's light therapy,
Mhm.
where on the body can this device, the light, be applied to?
Anywhere except your eyes.
Okay,
Um, the thing with laser therapy is in the laser itself is safety factors. So each device has a safety rating. So you may
hmm,
hear something called like a 1M,
okay,
class 3, or a 3B and a class 4, the typical ones that are on the market. So a class 3B and a class 4 laser, you have to wear safety goggles to protect your eyes, otherwise it could damage your retinas. A class 1M, you should still wear safety goggles, but is less likely to cause any damage to you. It's a lot
okay,
safer laser. So multi-radiance medical products, the ones that you would use for fibromyalgia, are all 1M rated safety ratings.
okay. So I agree. It would probably be a good idea to first go to a clinic that
Mhm.
already has this because you have to put money into your flex spending account. So you need
Mhm.
to have an idea, you know, how much money that is going to be.
Yeah.
Now, as far as chiropractors and other types of practitioners, I'm going to talk to my rheumatologist about it. My fibro, thank goodness, is now under control, but a lot of my clients, theirs is not under
Mhm.
control. They're on Social Security disability, or, you know,
Yep.
if they didn't get it approved, they simply are not able to work. And what I want to ask you is, we refer to it as the invisible disease because
Mhm.
people can see fibromyalgia patients and they'll say, oh, they look fine. They're not limping. There's no cast. There's not this. There's not that. And I think that many people simply don't understand what that pain is like. They'll say, oh, I have a headache. And I've explained to people, you may have a headache. You may take Tylenol, leave whatever you want to take for it, or take nothing. And it may be gone. In my case, and many others, when I was diagnosed with fibro, mine was not like that. It was very severe. I woke up with pain, went to bed with pain. It was never ending. And it was like this way for about 5 years, unrelenting,
Mhm.
nonstop, which is a different type of pain,
Mhm.
totally. And for those that's not really familiar with it, can you explain to the audience what exactly is fibromyalgia?
So fibromyalgia is a chronic pain syndrome, typically defined by the American College of Rheumatology. They have a criteria that they go by, and typically it is based on 18 or 19 tender points that are common across the board, but also some other cognitive things that are going, or other somatic symptoms that may be going on in conjunction with that. So it's a lot of times you have some depression,
Yes,
anxiety, you have other symptoms. You may have some GI tract symptoms along with this. You have some other symptoms and combined with that. And what they do is they have you score how many tender points do you have, how many somatic centuries, and they come up with a score. And based on that score, they determine whether or not you have fibromyalgia or not.
true.
Okay.
And I remember when I was diagnosed, it's like everything was checked off. And then I remember the fibro fog. You know, many
Mhm.
patients, besides the fibro fog, sleep, as you know, is a really big
Sleep's a big
issue.
one. Hmm.
Yeah, because if you can't sleep, your body very well just cannot heal.
Yep.
So for this product, who would you say is really geared towards in terms of a fibro patient? And I ask that because there are some fibromyalgia patients who may have it, but it's not as severe. You know, there are some that it is just very, very severe. So, whom would you estimate could benefit the most from FibroLux?
I think everybody could. Um,
Okay,
in my opinion, I think so. Part of it is if you have a clinician that has this and can treat you, um, the treatment protocol that we put forth or we think is going to work best is to get treated a couple times just with the laser to see it affects your pain, and then start adding exercise. because as we know, American College of Sports Medicine, their whole thought is if you can get the people to exercise, it's going to get them better and help them out. The problem
True,
is, as you know, a lot of fibromyalgia patients don't want to exercise because they're afraid of how much they think it's going to hurt. So pain
true.
catastrophizing, or they're
Yes,
not sure. And if they have a device that they know is going to work for them, they're more likely to exercise.
that's
So
true.
the one study that was published by De Silva, basically they looked at, they had a group that was basically a laser similar to the FibroLux. They had a laser only group, an exercise only group, and an exercise and laser group. And that exercise and that combination of exercise and laser had such huge differences or improvements compared to the other groups. It was amazing. So, I mean, you had decreases in like 70%
Mm,
decrease in number of tender points. You
that
had,
is wonderful.
and that combination seemed to be more synergistic with using the laser and combining it. But again, if you don't know it's going to work, or the first time you're using it, you've never used a device that works for you, you're like, oh, wait a minute, my pain's starting to go down. You're not quite sure what to feel like. So one patient was very skeptical. She's like, nothing's worked for me. We treat her with the laser. She's like, oh, wait a minute, this is different. And she got better. And then she started to exercise, and she exercised for the first time in 14 years, and she hurt her shoulder because she wasn't ready for it.
Yeah,
Right.
yeah,
So again, that combination of thinking about it, not just, hey, my pain is gone, we need to get you active, but to get you active safely, right? Because if you
yes.
haven't exercised or done anything in a while, you need to slowly build up. You've changed how you walk, how you sit, how you do things, you try to get comfortable. So again, it's kind of making sure you're doing those type of things to make you overall improve more often. And that combination really helps.
In fact, it does. And as you were talking about getting physically active, one of the challenges, because I thinking about myself in the beginning as well as other patients, is movement, they tell you is vital. But when you're
Mhm.
in so much pain, for
Mhm.
me, it was a fear that if I moved, I was going to do more harm than good because the pain was intense. But I discovered that if I can do something that I enjoyed, that I didn't view as exercise, such as walking,
Mhm.
so in the beginning, I used to walk all the time. And then when fibro hit, I couldn't, I can barely get out of bed. I had to take small baby steps, walk a little bit here, maybe from my front door to the end of my driveway, or then to my mailbox, or whatever, just small steps
Yep.
until I can start trusting myself that I wasn't hurting myself.
Yep.
That helped me build confidence. And then I kept doing it. And then I discovered, like you just shared, that, hey, this is not so bad. I can do this.
Yeah, and I think the thing that the laser therapy helps with is gives you that confidence very quickly that there's a device that can help you control your pain. So
Yes,
that
that is true.
fear disappears rather quickly if you have something works. Because like most things on the market, most devices or most even the medications, they don't seem to work very well at all. So if you
No,
have
they
something
don't.
that works for you, you're more likely to exercise and move, which we know you need to do to get better.
The reason why I like learning about this product is because for some patients, myself included, I'm sensitive to a lot of
Mhm.
medication. With a laser, it's totally the opposite of that
Mhm.
because I have learned from experience they can give you a prescription for one medication, it's supposed to help whatever it is, and then there's side effects, and then everything seems to conflict with the other with a lot of patients. And what's challenging for a lot of patients, Dr. Demchak, is they tell me, I want a magic pill. I want to get this over with. And I tell them, it didn't start overnight. It's not going to leave overnight. And people don't want to hear that. So, what is an easier way to explain that to people that there's no magic pill for this?
Well, there's no magic pill because of how what they believe the etiology is, and what the cause is, right? So we don't
Right.
know specifically what causes it, but some of the things that have been done in the research is they've done biopsies on the tender points, right? So taking some tissue out to see what's going on. And what they found is, you have blood vessels that are constricted, right? You have increase in certain nerve fiber types, like the ones that carry the pain, are
Mhm.
in that area. So we know there's change or physiological changes that have occurred within the body in those areas. So again, to reverse that is going to take a little bit of time to kind of help reverse those changes that have occurred, right?
Yes.
Um, so that's part of what it is, and what we know with the laser. So with the treatments that we've been using, that have been successful with it, is we would just treat the active tender points. So you come in, I had my patients come in, here's your tender point chart, circle the ones that are affected you, tell me the pain level at each one, and then we would treat them, and I'd have them go back through and tell me what the differences were. And I would have people who have tender points disappear within a treatment. I've had people go from like a pain of 8 to a pain of 4 within a single treatment.
Wow.
Um, and again, mostly because those tender points are superficial in that peripheral nervous system. So again, it's a pretty quick change. Again, laser is going to help increase blood flow to that area and help inhibit the nerve transmission. So it's going to do those two things. And that's kind of what we think is causing a lot of those pain signals coming from those tender points.
Now, does the fascia play a role in this?
The fascia might begin. Some of it is the question with like the fascia changes could be, is the fascia bound down, and that's what's constricting the blood vessels? We don't know. The other thing is you'll probably have some fascial changes because, as you know, from a fibromyalgia sufferer yourself, you're just trying to get a position that feels comfortable for you, whether it's good posture, bad posture, then your body and your fascial system is going to adapt to that position. So if you
Yes.
feel better with your head forward and shoulders forward, like we see a lot of people with poor posture, right? That's one of the things you'll see. That fascia is restricted in the front, stretched out in the back, and you have to correct that. And again, you don't want to move, so you don't correct the posture. So those fascial restrictions get bound down even more. So part of that whole process to go from severe fibromyalgia pain to I feel great, you have to also, get rid of the pain or decrease the pain, and then kind of you've adapted to your new positions over those times. You have to release the fascia. You have to get yourself back to that good posture position. And that's going to take time because, again, it didn't happen overnight. You didn't magically have all those restrictions,
True.
right?
And a lot of times, I remember in the beginning, I felt myself exhibiting guarding behavior.
Mhm.
Certain things I didn't want to do for fear. Okay, I don't want to do that because I'm already having a lot of pain. I don't want to exacerbate it. But then eventually I had to retrain myself, even my mindset, how I viewed
Mhm.
everything. And I think that helped me get further along. Now, one thing that I've been focused on for many years is the causes of it. So, from what I've researched in terms of the causes of fibro, I've seen they said some type of trauma is some type of stress. It could be due to surgical procedure. It could be due to an auto accident. Um, Based upon your experience, what have you seen as some of the causes? Since this did not develop overnight with myself, I feel, and I could be wrong, I feel my perfect storm was I was working in an environment in the medical field, actually pharma, where I was bullied for 2.5 years. I had so much stress. Then I had an auto accident where somebody rear-ended me. Then I had to have a surgical procedure done. So I just feel for me, it was a lot of trauma. It was a lot of stress. I wasn't sleeping, depression because of the pain, not knowing how to go forward.
So great point. So part of it is there's some research that seems to show like fibromyalgia syndrome and some other pain syndromes like amplified musculoskeletal pain syndrome,
Mhm.
complex regional pain syndrome. Some of it seems to be the research is leaning towards there's something to do with the sympathetic nervous system. And the
Yes.
sympathetic nervous system is fight or flight, and it kicks in when you are anxious, when you have anxiety, stress levels, all of those types of things. And being bullied would be something that would cause that stress level to go up. Every time you walked into work, you're probably like, what's going to happen today, right?
Yes,
Your stress
exactly.
stayed at a high level. And that system is designed to turn on, get through your stress, and turn back off. The problem is
Yeah.
when it stays on and stays on and stays on and stays on, what happens is part of that causes vasoconstriction. So your blood vessels constrict down, which decreases blood flow to certain areas of your body, right? So I mentioned earlier the tender points, a lot of times they show vasoconstriction in those specific areas, which could be caused by the sympathetic nervous system kicking in too much in those areas, right? So
Right.
part of it is looking at is that sympathetic nervous system is overactive in a lot of these patients. And then you combine it with other things, right? Getting a surgery is trauma enough normally, but now
True.
you're already overactivated the sympathetic nervous system already. That just kicks it into the next higher gear, right? Auto
Right.
accident on its own is stressful enough, but you're already stressed out from work.
Right.
So that combination of things seems to be what you see in a lot of these pain syndromes, including fibromyalgia. There's a really good physical therapist called his last name's Lowe. He does like called pain neuroscience education. So like you've said, you've had to retrain your brain, and he talks about how chronic pain is a combination of the physiology that's going on and
Okay.
your own perception. And part of that perception is based on things like life stress. What else is going on in your life at the time of the incident? In your case, you said you were being bullied, you had surgery, you had a car accident, and you woke up with pain.
Yes.
Well, guess what? All of those things finally came together, and your body said, you know what, we're done.
Yeah, that's how
We're
I
going to
felt.
make you hurt so much. And
Yes.
again, you learned about pain, and it seemed to help you cope with it. So if we can just use a pain education as part of this, just teach people. You were afraid to do things, but you didn't have a musculoskeletal injury. It's not like you said, it's not like you tore a ligament, strained a
Right.
muscle, any of those things. But you were afraid to exercise and move because you thought you were going to cause more damage, even though there was no tissue damage, right?
True.
So
Very
that's
true.
very much like a patient who gets injured, recovers from the injury. The MRI shows there is no damage whatsoever, yet they still have severe pain. Very similar mechanism that's going on. So a lot of this is all these things kind of working together. So part of it is, can we educate people just generally about how pain works? Because that seems to help decrease people's pain levels and stress levels. We know that. Giving them some sort of device like a FibroLux laser, something that's going to help decrease their pain that they feel, and then add in exercise. And right there, you can get people to recover probably pretty quickly. And that
True.
combination really seems to work with a lot of patients.
Is there any inflammation involved with this?
There doesn't seem to be. It's a non-inflammatory. So that's the other thing that freaks people out is it's painful, it hurts. Doesn't show up in an MRI,
Right. True.
doesn't show
Doesn't.
up in your CT scan, your x-rays are all fine.
Yep.
There's nothing. You're fine. What are you talking about? You have pain there, right? Because you've seen that. And then it
Yes.
makes your stress even more because the doctors don't know what's going on. All the tests are negative, and they're like, then you get more fearful because they don't know what's happening,
True.
right? So that combination on that brings up your stress level, sympathetic nervous system kicks in more. All of those things work together to lead to this. And
So
why
hence
people's
the invisible disorder is real.
it is very real. And
Yes.
again, I think how it manifests in people are different. In your case, it manifests as a fibromyalgia syndrome. Somebody else, it may be chronic, you know, um, chronic fatigue. Somebody else, it might be, you know, amplified musculoskeletal pain if it's a younger person. All of these things are kind of complex regional pain syndrome. So it's all linked together. And then what I learned, we went to the American College of Rheumatology conference last November, right? We took the FibroLux, had it showing in the exhibit hall, and then we kind of just walked up and down the exhibit hall and learned a lot about this. So it seems like, a lot of people with either fibromyalgia or start with one chronic pain syndrome and then start getting other things. So somebody with lupus starts having fibromyalgia or starts adding things to their symptom list and what's going on. So again, it's not just one thing, it's like, how is this all linked together?
That's a very good point, because what came to my mind was also costochondritis.
Mhm.
You know, you get that pain where you feel like you're having a heart attack.
Yeah.
I've been to the ER, admitted for observation several times because they want to rule out everything,
Mhm.
and to find out, no, it's nothing wrong with your heart. It's just so, but with costochondritis, but that's inflammation behind your chest wall, though, right?
Mhm.
Okay.
But I could laser that and calm that down, right? I could treat
Yes,
that and calm that
exactly.
pain level down and help that inflammation get better very easily with a laser. Not just for fibromyalgia pain, but I can use it for other things as well.
That is fascinating because I find a lot of fibromyalgia patients, such as myself, it's not just fibro. Some of
Hmm.
them may have ankylosing spondylitis, like you said,
Hmm.
lupus, a variety of other things. It just seems to me that when I was diagnosed, it was just like the perfect storm that everything seemed to be happening. And how I view it is like the thermostat in your house.
Hmm.
You can turn it up, you can turn it down, except I felt in my body that it was stuck. It was all the way up and I couldn't turn it down.
Hmm. And again, depending where you are on that fibromyalgia journey and how much it's affecting you and how early you get intervention determines some of that and what effect it's going to have. So for example, at the conference, there were individuals from the US Pain Foundation, some other fibromyalgia groups, and they're all excited about the FibroLux. And we're like, well, would you like us to treat you to see if it'll work? And they're like, yes. And we treated them, and then one person dropped her pain, dropped from an 8 to like a 2.
But that was shocking for
One
her.
treatment. It was extremely shocking for her. She is like, I've never had anything do this for me. And again, that's the kind of treatments and outcomes I saw with my patients. Um, and again, it's kind of huge, right? If you can have that much of an effect on somebody and their pain level gets down, as you've seen it, you
Yes.
feel like you can exercise and function and do more things. And
Yeah,
again, from
that
that.
and it changes your quality of life
Mhm.
where you can move forward, you can feel normal, you get to the point where you can, provide for yourself, where you can
Mhm.
contribute to your household. I mean, just to feel normal, like a normal person and be able to function.
Mhm. And it's huge. And depending how long you've had it determines how long it's going to take you to get back to that normal, whatever we define that as, area. And again, if you haven't exercised in a long time, then you know what, you're not going to be able to go out and run a marathon on day one,
True.
right? But you could be able to, like you said, walk to the mailbox, walk down the street a block and come back, do some sort of physical activity that you enjoy to kind of keep yourself moving and doing those things. And again, if you want to have something that a device can decrease your pain, you're more confident to go out and do those things, knowing that, hey, if I hurt a little bit, I can just use the laser and it's going to calm my pain back down. I can go back and do more stuff.
That's
Right. And
true.
that's kind of that combination of things is really important.
I
And
wish I
again.
would have known about this in the beginning because I think about people who have had to take time off of work due to FMLA, can't function. This can
Mhm.
help people who've been waiting years to get approved for Social Security disability who may not get approved,
Or
just to bring back normalcy to their life where they just feel, okay, I can manage, I can get through this.
I can manage. And again, like if you've had it and suffered from it, what was your average pain level when it was this most severe for you on a scale of
Oh, it was a 10.
10? So if you could have got it down to a 2, you'd have been like, woohoo, I'm good.
Yeah,
Right? If it
true.
was 2 all day, you'd be like, hey, I'm happy, right? So I
Yes.
think it's kind of those type of things that you can use this for. And again, you can use it a FibroLux in a clinical model where you're getting treated a couple of days a week. You're paying for that treatment and you're adding exercise to that as your pain levels drop. You're starting to exercise, and you may be able to take that out maybe a month or two out, and all of a sudden you're really feeling great. And if you have a flare up and you know your clinician really well, you can call them and say, hey, I need to come in and get a treatment.
That's
That's one
true.
model that would work, right? Other models that are out there is, you know what, this worked great for me. I can't afford to go there, but you know what, I have like workman's comp willing to pay for it, or you have enough money saved in
Hmm.
an account that you can pay for it, right?
True.
And it's like you figured out, you know what, the cost I'm paying for all my medications that aren't working
Yes.
is more than what I could buy a laser for, right? a lower
Right.
level laser.
Yeah.
Yeah. So again, it's kind of looking at those circumstances and what's going to work best. And there are some clinics out there and some clinic models out there where they rent the laser out to you, right? They own a bunch of them and they rent them. But I don't know what, Chicago area, it depends what area you live
Right.
in, right? In our area in Terre Haute, I treat with laser, and there's a few other clinics that treat with laser. But mostly because I had them as students in my classes here, and they stayed in our therapists in town, and they learned how to do laser here, right? So again, it's how much you're taught and how much you know about it and learn about it.
That's an excellent point because in the beginning, as I saw, it took me to see 7 different physicians before I
Hmm.
received the diagnosis.
Hmm.
By the time I got the diagnosis, I mean, in the beginning, I was told it was in my head that I was just too emotional, that there was nothing wrong with me. So that made it more depressing because I know that I'm sick. I know that I have pain. So I know this is real. I know that I'm not imagining this. Sometimes patients are made to feel as if there's nothing wrong with you. Then to get a diagnosis, and I think about all the money that was spent um, every 2 weeks seeing different doctors,
Hmm.
trying all the prescription drugs, then dealing with IBS. So there's IBS. I mean, medication for sleep. Then I'm sleepwalking, things I would eat, everything seemed to just set me off. Wake up with pain, go to bed with pain. In the morning, I wake up, I can barely crawl out of bed. It was just a roller coaster. I just felt that I was just coming apart because I'm the type of person that was active. I'm out there, I'm getting things done like I'm supposed to, function at a high level. And then this hits,
Hmm.
you know, and when you're at work and then that fibro fog hits, even if you're not at work, but when you're dealing with fibro fog, people don't understand that. They look at you as if you're slacking, that you're making excuses for not being able to work, for not being able to get things done. And that in itself causes stress.
Well, it's yeah, and think about it. So you said IBS. Well, IBS is somewhat related to sympathetic nervous system as well.
Yes,
So again, it's kind of that all that life stress and everything combined all kind of hit you at one time. And that's part of what they think is going on. And again, how you treat that, well, medication doesn't work for that.
no, mm-mm.
So we know that. So again, laser's big market is vet market to start with. And again, it's slowly making its way into in clinical practice. But again, one of the roadblocks is doesn't get reimbursed very well,
Right,
right? Like any modality. But the thing is, if the therapist understands, what, if we use it to help decrease your pain, then the therapeutic exercise is going to take off and start working and start doing more stuff.
true,
So, the roadblocks I've seen with laser is mostly the clinician either doesn't understand it very well or they don't see how they can incorporate it with what they currently use and their
true.
model that they're doing. It's like, why would I use laser if I, you know, and I can get reimbursed for it as much? Well, you use it because if I can get your pain level down, then you can start doing therapeutic exercise with the patient and start doing manual therapy with the patient because that's what they're going to need to correct the fascia restrictions and those other things that have happened over the however long they've had fibromyalgia. Does
Now,
that
are
make
you
sense?
accepting new patients? Because I know that you are the founder and director and main clinician of athletic training services at Wabash Valley Health Center.
I did that until 2019, and
Okay,
when their board decided not to continue that program there.
okay,
So I don't have a clinic I treat with right now. There are some possibilities that are going to happen in the near future within our own university,
okay,
but we don't know yet. What I do with patients who find our article, so find the fibromyalgia article or find other articles that we've published, like on migraine headaches and doing those type of things. Typically, what we try to do is work with Multi-Radiance Medical and find a clinician in their area that uses their devices, and
okay,
then help the patient connect with them and help talk to those clinicians and how to treat with that device for that specific pathology. So if I say you are in Illinois and you found our article and said, you know what, can you treat me, or how did I get this? And we could find a clinician in that area that owns that device or owns a device from Multi-Radiance Medical and see if we can get you set up and talk to that clinician on how to treat fibromyalgia.
Hey, I was asking because I was thinking this would be a great road trip for my fibromyalgia warriors where we can take a trip and make an appointment and get therapy, because it's not just, although I live in Illinois, the people that are served, they're global, they're
Mm-hmm.
all outside of Illinois, so I was just thinking about the benefit of this. So I know it's
Well,
FDA approved. Can people in the UK, is this offered there?
so I don't know how much FibroLux probably isn't there yet because of all the
Okay,
laws in between, like what devices you can sell. Internationally, it really comes down to, I don't know what their physios are doing over there, because I think that's what their main group over there is, the physios. And again, as far as road trips go, you know, we can set up a class period where our students are learning how to treat fibromyalgia patients with laser, and you just happen to be the patients.
okay.
Because again, it's chronic pain syndromes. It's teaching
Right,
patients. It's not just teaching them about fibromyalgia. It's teaching them about the whole story, right? So listening to you about your story and your journey of how you got to the fibromyalgia makes a lot of sense for what we know about chronic pain, right? Now,
right.
the treatment of that or how you've recovered from that is, you told me you changed your mindset, you started exercising.
Yes.
That's basically what we're teaching our patients with chronic pain. You have to do those things. And if you use a device that happens to decrease that pain faster to allow them to get to that exercise faster, that's going to be more beneficial to your patient.
Yeah, it was very beneficial to me. I get discouraged sometimes because I talk to some patients who have said to me, my physician says that there's no cure for fibro, so why should I even try? And I tell them, okay, there may not be a cure, but that does not mean that you have to live that way. You can improve your quality of life. And they'll
Mhm.
say, well, how? And I say to them, mindset played the biggest role for me, because if I can see myself getting better, if I can believe myself that I am going to get through this and be
Mhm.
focused and not afraid to take steps, I can do this. And I
Mhm.
tell them, if you get to the stage where you totally give up and you're not willing to consider any other options, I personally feel that's when the pain can be the absolute worst.
That's very true. If you do that, then again your sympathetic nervous system's all fired up.
Yep.
It's all going. All those things are being released. And again, it's we know mindset's a big part of it. So one of the things that have my patients do is, just before you go to bed, write down 3 positive things that happened to you that day.
Yes.
And I don't care if it's, I got out of bed, I went to the bathroom and back. Keep it simple. Don't get too crazy.
Yes.
But those are all, again, it's not just using the laser to decrease their pain, it's also getting them to do other things with their lives. So it's that combination of things, and help them reflect back on how the benefits are,
That's
right?
true. I like that. Also, journaling.
And
So for
journaling.
me, with the mindset, I journaled for several years. And one day when I was doing some cleaning up in my office, I opened up some of my journals. Oh, it was painful to read some of the stuff that I had journaled, that I had written about. Then it made me cry, and then I had to stop and say to myself, why are you getting upset? Because that was then. Look where you are today. And that for me was liberating. It was life changing to see, hey, I used to be over here. Now I'm on the other side of that mountain. I'm functioning. I'm able to go back to work. I'm able to do certain things. I may have pain, I may have flares, but I'm not that person anymore.
And that's a big part of the journey, right? Um, other options are, there are other fibromyalgia groups up, I think, in the Chicago area, right?
Yes.
And that's a short drive for me to go up there,
Okay. All
right?
right, you're giving me something
You
to
know what
think
I
about.
mean?
We can make
You
this
know what I
happen.
mean?
Yes,
There's two ways we can do this. You can come
yes.
here where we can, I mean, that's a short drive up to Chicago. So again, coming up and having a group and talking to everybody through it and then treating people and doing as part of that is let's see if this is something that might work for people. There are
Hey, I
lots of
can reach out
ways,
to the other groups. We
lots of
can do
ways to
this.
do this. Um,
Yes,
so again, light therapy is a way to help control that pain and allow the person to be able to get to that exercise part or get their mindset changed a little bit from nothing's going to help me to, oh, guess what? Here's a device that can help me and can start making me feel better. And then you get more active, like, oh, I can actually do things, right? I can actually move and do stuff and things like that. I mean, my patients that had did this were just amazed at what they could do.
I'm
Like I
certain.
said, my one was a 19-year-old college student, and she graduated and went on to law school. And she was at the point where she was flunking every class when she started.
Mm,
And she just it kind of just completely changed her whole mindset and belief and got her pain under control and her depression reversed and all of those things changed
mm,
because of that. And it's really kind of an interesting story. And the other person had fibro for 14 years and she had nothing was going to help her. And she didn't know why they sent her to me to get treated. And I'm like, well, this is what's worked for me before. You want to try it? She's like, sure, it's not going to work. And she got treated and she's like, oh my gosh. I'm like,
yes,
here you go.
yes. As you know, there's no harm in trying. I
So
think back to
it's,
myself that I participated in two chronic pain boot camps.
mm-hmm,
One was for 6 or 7 weeks.
mm-hmm,
It was 8 hours a day.
mm-hmm.
And when that 6 or 7 weeks had passed, they told me that I failed boot camp. And it really hurt me because I said to myself, I'm doing everything you all tell me to do. How could I have failed this? And I realized they were looking at outcomes such as by this date and time, you should be pain free. You shouldn't have this. I was not that patient who fit the mold that they were looking for. And I realized, okay, had I known this, I probably wouldn't have signed up for that because I was not the type of patient that they were seeking.
Yes, those are very interesting studies to read.
Yes.
Mm-hmm. So I think the idea behind the boot camps is what they're trying to do is reset that sympathetic nervous system. So
Mm-hmm.
there is a group in Philadelphia area that does amplified muscular pain syndrome patients. And those people not familiar with that, that is basically juveniles who have a chronic pain syndrome that doesn't fit a defined category. So it doesn't fit fibromyalgia, juvenile fibromyalgia. It doesn't fit rheumatoid arthritis. It doesn't fit anything else. And it's kind of just a general overall pain syndrome that doesn't fit anything else and specifically for juveniles. And we actually, my friend Chris Caraway was on the articles with me. He treated a amplified muscular pain patient, just treated the sympathetic nervous system, and the person got better, completely better without having to exercise, without having a boot camp, without having anything else. Just got better because he
I
reset
attended
the
a
sympathetic
workshop.
nervous system.
I attended a workshop with someone who flew in from the UK. His name escapes me right now, but it was dealing similar to what you're talking about and how he had us to approach the pain and he also had us focus on the amygdala. Am I pronouncing that
Hmm.
correctly?
Hmm.
Amygdala.
Yeah, amygdala. Yep.
Yeah. And he was talking about the benefits of trying to help reduce the pain.
Hmm.
But I found, like I said, for me, journaling mindset played a big role. But what I wanted to ask you is, I know we're soon running out of time, is
Okay.
what do you say to those people? So when I mentioned that it didn't develop overnight,
Hmm.
right? But then I don't know, you wake up one day and you start feeling crappy. And in my
Hmm.
case, so much had already happened. So what happens in the body? Does all this stress, trauma just converge, and then all of a sudden it's just bam, here we are.
Yeah, I've heard that story from a lot of patients, and it manifests itself differently. And part of it is is I guess teaching a patient or a person how that pain might have manifested. So taking them through the fact that, how pain actually works, right? So part of it is basic pain physiology. And again, most people don't understand that pain is a perception in your brain, right?
Okay.
No matter how
Got
much
it.
the signal's coming from the nervous system, your brain still has to interpret it. So
Yes.
it's how your brain perceives that is what the pain you feel. And the more other things you have going on that affect that perception, i.e., life stress,
Yes.
bills aren't
Yes.
getting paid, car accidents,
True.
surgeries,
Loss of job,
bullying,
everything.
loss of job, everything plays a role in how your body perceives that pain. And the amygdala plays a role in that because that's an emotional center. It has those types of things. And in like an injury standpoint, right? So I always come up from a musculoskeletal injury because I am an athletic trainer. But from that standpoint, you also have a pathway from your brain that sends signals back down the spinal cord. And it can do one of two things. It can help inhibit the pain because your body's like, you know what? You've had that before. It shouldn't hurt that much. You're fine. Dampens the pain level. It releases natural opioids. Or it
Okay.
can do the opposite effect. It can cause the pain to amplify. So
Yes.
when you have all of that stress, things like that in your life, that signal is going down and amplifying that pain if you have a pain signal coming from the periphery, right? Because it goes from the periphery, from like your hand to your spinal cord and then up to your brain. So if you can do that or have an effect on that, your brain's going to have an effect on all that perception. So part of it's just teaching people how pain works in the body, how your life stresses and those things affect it. And then talk about, what, if you've exercised, you don't have any musculoskeletal damage, so you're not going to hurt anything else by exercising a little bit, by walking a little
True.
bit and keeping it within your pain levels and your confidence level. And that's part of it. The other part of it is, okay, is there something that's going to help you reduce your pain, right? And again, we
Right.
know the more physicians you see before you get diagnosed, the higher your stress level is, the more your chronic pain is going to go up. We know that. So you said you saw
Yes.
7 people.
Yes. That's a
Nobody
lot.
could figure it out. And every time you felt
No.
nobody can figure this out, they say, I'm not having anything. I know I have pain. It just gets worse. So again, a lot of it, we know so much more about chronic pain. It's getting to the right people who understand how to treat it right. And if they're just
True. And
giving you
patients get frustrated when you see so many different providers. That's when you start giving up. Some people saying, look, I've been here, I've been there, I've been everywhere. I remember once I traveled to the Mayo Clinic for another condition, and I learned a lot uh, while I was there. It was a good experience for me. And I was a little bit angry because I learned that they had like a fibromyalgia clinic. And I was angry because I felt, wow, now I'm learning about this. If you know about certain things and is, you know, known and is out there for people to grasp, it can really be a game changer. It's frustrating when you suffer for so many years in silence and you don't know, because then you feel like, hey, I know for me, I felt, had I known about a lot of these things like what we're talking about now, how you be so much further ahead of the game versus
Mhm,
behind that 8 ball.
mhm, definitely.
Well, we're definitely going to have you to come up, put something together. Now you're in Wabash, Indiana, right?
I'm in Terre Haute.
I'm sorry, Terre Haute. So I'm trying to think now. So are you, because I used to have neighbors that lived in Terre Haute. So are you what, like 3 hours or four
three
outside ish?
hours. Three
Okay, that's
hours.
what I thought. 3 hours.
Mhm.
Okay. Well,
Straight
I
up
will be
41.
okay.
Yeah.
I'll be in contact with you where we can set something up. Now, again, this FibroLux,
Hmm.
when you come up, would you be able to also, would this also be applicable for people, for example, with ankylosing spondylitis?
It should be. I'd have to look through what that etiology of that is, but the
Okay.
FibroLux is FDA approved specifically
Right.
for fibromyalgia.
Fibro. Right.
Now they have other, like I said, other laser devices. I use those for all sorts of chronic pain syndromes. So that's the one thing. And again, any laser, I can use a laser to help with any type of chronic pain syndrome. So would it
Okay.
help with should help with that depending on where it is and how we treat. So
Well, maybe
again,
we'll just stick to fibro for the first time because I'm thinking about some people who probably will be interested in just driving in. So my support group members who may be up by Ohio, Wisconsin, and other states in the Midwest, they may be very much interested in driving in or flying in.
mhm. And I would think it would be something like we'll talk about, just basic physiology of how pain works, chronic pain, and then where it fits, where fibromyalgia fits into that idea, and then where laser fits into treatment for that idea. And then we can
Okay,
also take questions and spin off of that. But that to me seems like would be a way to educate a lot of people about how all this, what they think how all this works.
that would be great. And then they will be able to try FibroLux.
I could probably get some FibroLux to try. Yes,
Okay.
can work with
Well, this would
multi-rateds.
definitely
Gertie,
be
Gertie
well
would
worth it. Yes.
Gertie would figure out how to get me some FibroLux, or at least one FibroLux to do up there.
Well,
Um,
I thank you for your
would
time
work
today.
for that.
This has been so informational. You've answered a lot of questions. This is going to help a lot of people, especially
Mhm.
my audience, because since I've moved beyond a certain point with fibro where I feel better, my mission is to help as many other people
Mhm.
get there and
Yep.
not suffer in silence. And I've met a lot of men online who have fibro,
Yes,
but
which is very
yeah,
rare.
it is. And they don't talk about it because they're the breadwinners and it's not something they want people to know that they suffer with. And real quick, I want to share you a quick story, if I may. Years ago, I got a telephone call and an email. It was the FBI. They were doing a workshop on fibromyalgia.
Wow.
They found my website online, reached out to me for some assistance, and I thought, wow, this is a big time thing because this was when
It's a
I
big
got
thing.
my not-for-profit set up and everything else. I started meeting all these different people. And then I recognized at this point that this is bigger than my little circle, my little world, that I'm in.
Well, you figure 20% of the world suffers from chronic pain syndromes,
Yes.
right?
Wow.
And it's a worldwide issue. So your person from England are suffering just as much from chronic pain syndromes as we are in the US,
Yes.
minus probably the opioid epidemic. So one of the reasons we have issues here a lot of times is I just give you some medicine and you'll be fine. And now we have fibromyalgia plus opioid epidemic or all these other things along with it. So yeah, it's a lot and it's a big issue in the US and around the world.
True. Well, I thank you for your time today.
You're
I
welcome.
will be in contact with you where we can set
Hmm.
something up.
Okay.
And is there anything else you would like to share with my audience in terms of how they can get in contact with you? Is there a website or anything you'd like to share or
Um,
provide it?
Usually my email address at Indiana State's the easiest one
Okay.
to get in
All
touch
right.
with me for. Hmm.
Thank you. And I will make
You're
certain
welcome.
that everyone can see all the photographs regarding the FibroLux so
Yep.
that they will know exactly what
And
we're talking about.
yeah, the one thing they may look at is they can look at there's our case study I published in Practical Pain Management. That's an online journal they can find
Okay.
very easily. And then I think the other thing is look at like Laser Therapy University. That's a
Okay.
online storehouse for laser itself, and they have a lot of links to articles and they have a lot of webinars and things like that to learn just more about laser if they want to learn more about that itself as a
Okay.
modality. That's a good one to just learn about stuff.
That's
Um,
fine. And was it you mentioned something? Was it you gave me a name?
yeah, I can't hear what you're saying. You're outside your
Oh, I'm
microphone.
sorry. We discussed before, you mentioned about pain neuroscience.
Yep. So Adrian Lowe is the
Okay,
guy who
low.
does a lot of that. So he has a lot of YouTube videos that you can watch.
Okay.
And then the other one who talks a lot about pain. Shoot, I have his book. Hold on. It'll come to me later. But there's some really good videos out there that just talk about generally about how pain works.
Okay.
And those are all really good ways to kind of start educating about. So I teach this. So one of my classes I teach at Indiana State is we do a 3 weeks on pain, how pain physiologically works with the chronic pain syndromes, how this all works. So I teach all these undergraduate students who want to be healthcare professionals how this works because it's
Is
important.
that
They're going to
ever
treat people
offered
with pain.
online?
It is not an online course at this time.
Okay.
Um, But it's, again, that's kind of what I would come up and teach. If I came up to you and do that, that's kind of what I would do, is I would go through that stuff at a level that everybody should be able to understand. And
That's
then
fine. And
throw
how
in
much
how
time would
laser
you
works.
need for this workshop?
Wow. I do not know the answer to that question at the moment.
But I'll be in touch with you. We'll work it out.
Yeah, we'll work that out. But yeah, that's kind of where I would see this to go, and help as many people as we can as do something like that.
Okay, well, I thank you for your time today. You have the last word. Is there anything else you would like to share with the audience
That is
that
all.
hasn't been
Everybody have
said?
a wonderful, enjoy the sunshine and get outside and walk. Enjoy it.
All right.
So,
Thank you for your time, and I will be in contact with you.
okay.
Thank you. I'm so appreciative. It's
You're
a
welcome.
pleasure to have met you.
Yep. Thanks, Nisi. Same
Thank you.
here.
Okay,
Bye.
bye-bye.